Well, thank you for coming, everybody. Today, we're here at Nepean Hospital. I'm joined by Dr. Jeremy McAnulty, head of the Public Health Response Team, as part of Dr. Kerry Chan's Public Health Team, Dr. Ni Nguyen, who's the ICU specialist here at Nepean Hospital, and also Minister Ayres, who will speak to some of the further changes we've made today in relation to workforce and rapid antigen test procurement. Well, can I begin by saying it's a very difficult day for our state. Over the last 24 hours, we've had 16 people who have died from the virus. On behalf of everybody across our state, can I extend to those families our thoughts, our prayers, our hearts go out to every single one of you as a result of the loss of your loved ones. And Dr. McAnulty will make some further comments in relation to those cases, but also more broadly in relation to hospitalisations and ICUs here in New South Wales. I want to begin by thanking all our fantastic health staff right across our state. Minister Ayres and I had the opportunity to thank many of those staff here, our nurses at Nepean Hospital, but right around New South Wales and right around the country, we have health teams who are doing an extraordinary job in keeping people safe, in providing essential health care to those not just with COVID, but more broadly with a health system that is under pressure. Whether it's here in New South Wales or around the country, we rely on our frontline health professionals to continue to look after us. They have done an amazing job over the past 2 years, and as we move through what will certainly be a challenging 3 to 4 weeks for our state, we will rely on them more than ever to continue the great care, the great compassion in which they look after every single person right across the state. So can I thank every one of them on behalf of the people of New South Wales. Our key message today, though, is still in relation to vaccination. We have one of the highest vaccination rates here in New South Wales, and that is key to keeping you, your family and your friends safe. We've seen here in New South Wales a 93.7 double vaccination rate, and we have over 95% of people with a first dose vaccination. I say to anybody out across New South Wales today who've received that first dose vaccination and is eligible for your second dose vaccination, please go out and make the effort to get it done. It's so pleasing. We never believed we'd be in a position with over a 95% vaccination rate, but we really want to ensure that that second dose vaccination rate gets above 95%. So if you haven't received that vaccination, that second dose vaccination, please go and do so. And if you haven't received that first dose vaccination, please go and get vaccinated. The numbers don't lie. If we look at ICU numbers, if we look at hospitalisation numbers, there is no doubt, it is very clear that vaccination is key to keeping you safe. Our booster shot campaign continues right across the state. We have 40 centres open. In the last 24 hours, over 15,000 third dose booster shots were administered in our facilities across New South Wales, over 320,000 now across our state. And as we head into mid to late January, we'll be seeing just in our centres alone around 300,000 booster shots per week administered. As I've said in the past, you can have that booster shot administered at your pharmacy, your GP, or at one of our centres simply because you've had your vaccination shots in either in a hub or your GP, your pharmacist. You don't have to go back to the same place. Please make those appointments. And as of tomorrow, and Dr. McAnulty will speak to this as well, as of tomorrow, we will be rolling out vaccinations for children aged between 5 and 11. That commences tomorrow. Many people have made those bookings, and that is key as well as we move through this next phase. Today, we've also announced that in addition to the 50 million rapid antigen tests that we have procured, that we will be procuring an additional 50 million as well to take those rapid antigen tests procured by the New South Wales government to 100 million. And we will be rolling those out. Across the state, particularly in those areas where there are vulnerable people. We're already at the moment, as of today, have been reaching out to remote Aboriginal communities with those rapid antigen tests. These tests will be crucial to ensure we get kids back to school day one, term one. We are finalising our back to school plans at the moment. This will be a core tenet of those plans of getting kids back in the classrooms, we are completely committed to doing that. That is exactly the focus of the New South Wales government. It is crucial that kids are back into school on day one, and that is our focus, and we'll be raising those plans with the federal government at National Cabinet later this week, and we will, once we've finalised those plans, we will release them to the public so that parents right across the state can have confidence that we'll be able to achieve ensuring that kids are back on day one. There will be bumps along the way. There will be challenges as we move through this return to school program, but ultimately we can't let perfection be the enemy of the good. We need our kids in class. It is very, very clear that that is the best approach to take, and we are committed to doing that. And our booster campaign and through our rapid antigen test that we have procured, that will play a key role in ensuring that we can achieve that outcome. And we've had the first set of rapid antigen tests arrive yesterday, and we will see over the coming week and the weeks ahead those additional tests coming through. This will be very important as part of the new norm as we move through the next phase of the pandemic, that rapid antigen tests need to be provided and available to people right across the state, but from our government's perspective, particularly for those in vulnerable areas, in aged care and disability services, and I know a lot of those areas are in the domain of the federal government. From a state government level, we will do everything we can to support that rollout and complement it. So Minister Ayres will speak further to that. The other change we made today from New South Wales Health is an exemption for close contacts in essential food distribution networks. We had a similar approach during the lockdown period in relation to essential workers, and what that will mean if you are deemed by your employer in an essential food distribution network or manufacturing, that through the provision of a rapid antigen test on advice of your employer, you'll be able to return to work if you are asymptomatic. So that change comes in effective immediately today. Those orders were signed off this morning, and we believe that that will ease the pressure on supply and distribution networks, particularly for those essential areas across our state as we move through the next few weeks. Finally, in relation to those people who are at home who have had a rapid antigen test that is positive from mid this week, the advice I've received from Service New South Wales and from New South Wales Health is that you will be able to register that positive rapid antigen test through your Service New South Wales app, and that will ensure, through the advice of New South Wales Health, that we're able to connect people who need it with care. So it's not simply for the purpose of registering case numbers, it's for the purpose of connecting those people with underlying conditions with care. As the Prime Minister has also said, if you do have underlying conditions, then please contact your GP if you have any concerns, but we believe this program will assist. We'll have further to say about that over the course of the week, but obviously in circumstances where you've received a rapid antigen test and a PCR test that is positive, there will be no need for you to register through Service New South Wales because your details will already be connected to New South Wales Health through that PCR test process. So before I pass to Dr McAnulty to give a public health update, and then to Dr Nguyen to talk about the work that is occurring right across the state in our hospitals and the fantastic work that our nurses and doctors are doing day in, day out. There is no doubt for our state that this is a difficult time, just like across the country and just like across the world. But we have, as a state, as a people, have stood strong, incredibly strong, over the last 2 years with all the challenges that have come our way, and we've got through them like we will get through the next 3 to 4 weeks and beyond. If we can continue, and speaking to the nurses today about their experience with patients coming in what has been a difficult environment, the kindness and respect that has been shown from people to our health staff, but if we can continue to show that kindness and respect to everybody across the state to maintain that patience, the people of New South Wales will come through this difficult time as strongly as we have over the last 2 years. I'll now pass to Dr McAnulty for a public health update. Dr Nguyen will then speak to some of the challenges and experiences in hospitals, in Nepean here, but across the board more broadly. And then Minister Ayres will give some further information in relation to the acquisition of those rapid antigen tests and changes to close contacts in relation to food distribution networks. Dr. McEnulty.
Thanks, Premier, and good morning, everyone. Good afternoon, everyone. So, as the Premier mentioned, we've got good immunisation rates at the moment across the community. In people aged 16 years and over, we now have 95.1% having their first dose and 93.7% their second dose. Of people aged 12 to 15 years, 81.5% have had their first dose and 78.1% have received 2 doses. So while those rates are good, there's still room for people to be immunised, and we know just how effective immunisation is in protecting from severe disease. So it's important for your own protection, but also for your protection of your community, family and loved ones to just go and get that first shot if you haven't had it already, and make sure you follow up with your second shot. And of course, now that boosters are available for people 4 months after their second shot, go and make sure you've booked in to get a booster shot if you haven't already done so. In terms of hospitalisations, we currently have 1,927 people with COVID in hospital in New South Wales, 151 of whom are in intensive care and 38 are requiring ventilation. And there were 30,062 cases reported yesterday to 8 o'clock last night, and more than 98,000 COVID tests reported. Now, we know people are taking up the RAT testing, the rapid antigen testing, and so that's going to then mean that the PCR tests that we're reporting will come down as we see more people take up the RAT testing. As the Premier mentioned, we're very sad to report the deaths of 16 people today, 8 women and 8 men aged in their 60s, 70s, 80s and 90s. 7 people were from southwestern Sydney, 2 were from southeastern Sydney, 2 were from western Sydney, 2 were from Sydney's inner west, 1 person was from the central coast and 1 person was from the south coast and 1 from northern Sydney. This is the highest number of deaths we've had in any single day. Note that in the end of September, early October, reported 15 deaths on 2 days in the Delta outbreak. So again, our condolences and sincere condolences to the families, loved ones and friends of these people who've sadly died. As the Premier mentioned, RAT testing is becoming more widely available, and this week we're working closely with Service New South Wales to allow people to register their positive test result, and that will help ensure that people who've registered will be plugged in to the health system so that they'll get advice, and if they're in high-risk groups, be able to have specific additional processes in place. If you have a rapid antigen test, you generally don't need to have a follow-up PCR test, so that will make it quicker and faster for people to know their status, and as well as relieving pressure on the testing system. And please follow the advice. If you do have a positive RAT test, please assume it's the equivalent to a PCR test, so you'll need to isolate for 7 days, and you'll need to tell your family, people in your household, to isolate for 7 days as well, and also have RAT testing. And it's really pleasing to see that from tomorrow, the vaccinations will begin for children aged 5 to 11 through the vaccination centres run by the state and local health districts, as well as through GPs and pharmacies. So please take the advantage, come and get forward for vaccination. If you haven't booked already for a vaccine for your child, please do so now. Thank you very much.
Good afternoon, and thank you for the opportunity to represent the healthcare community and also Nepean Hospital. Just as you are, all the healthcare staff wait every day to look at what the numbers are that are reported, and we wait in anticipation. What we have seen over the last few weeks is that the vast majority of patients who test positive for Omicron or for COVID can manage well at home. And we sort of see that with those people who who are positive, there is good guidance in place for them to seek advice either from New South Wales Health, their GP, or through the hospital. There are really high numbers presenting to hospital, and we can understand the anxiety in the community faced with positive COVID tests, but we are sort of consistently seeing a very small percentage of those needing to be admitted. The patients who do come, though, still present a significant strain to the hospital and the hospital staff. However, we've learned a lot from the Delta outbreak, and I have confidence the systems in place will help the health system deal with all the patients who are presenting. The community, though, can help us by, I guess, getting a vaccine booster. Many of you will be due for your vaccine booster very soon. Getting booked in for those if you can and eligible, and do all those simple things that we've heard so much about and become so good at over the last 2 years, with physical distancing, socially sort of self-isolating when you need to, and also tried and true, sort of regular hand washing. So, a reminder, please, for the community to leave the emergency department and 000 for those who need it, and follow the health guidelines in relation to the to testing and PCR and the rapid antigen testing. We understand healthcare workers are under strain, and there's significant stress, but we're there to support them in any way that we can. And it won't be perfect, as a colleague told us over, in a planning huddle during the week, is that we know that over the next 3 or 4 weeks where the system will be under strain, it won't be perfect. But I have confidence that our health staff will do the very best job they can to look after the community they serve. So on a final note, I guess my personal plea is that if the phone calls to hospitals are left unanswered, or the queues in testing lines are longer, know that there's lots of healthcare staff and the broader staff, frontline workers, who are working really hard, doing the best they can to serve the community. So thank you.
Thank you, Premier. First, can I start by thanking all of the medical health team here at Nepean and extend that acknowledgement to people working in our health system right across New South Wales. The combination of these angels working in our health system and our high vaccination rates are allowing so many more people to be able to go to work, to be able to earn a paycheck and put bread and a feed on the table at home every single day. We've worked so hard for the last 2 years to get these high rates of vaccination, to have a well-resourced health system to be able to meet this challenge. As we've just heard from Dr Nguyen here at Nepean Hospital, there's no doubt that the next few weeks will be immensely challenging for our hospital staff. We are reaching the peak of this Omicron variant and this wave, and so we really do need to be able to tough out these next few weeks. But it's the long-term investment by the New South Wales Government and the commitment of our health team that is allowing us to respond to this very difficult challenge. To assist with that, the New South Wales Government has procured 50 million rapid antigen tests, which will be arriving from this week through to the first week of February. We'll also be purchasing another 50 million rapid antigen tests. This will support many of the people who work across the New South Wales Government frontline service sector, as well as people from vulnerable communities right across the state. We know people in social housing, we know people who are engaging with our Aboriginal medical services, we know people who are involved in disability home care, all need to be able to access rapid antigen tests in line with the New South Wales health guidelines. So the New South Wales Government is investing substantial amounts of dollars to ensure that we've got access to those rapid antigen tests. I also want to say very clearly that the advice that we've got through the New South Wales Government and our own health procurement teams is that the global supply chain on rapid antigen tests is recalibrating very quickly. As we're able to access more rapid antigen tests for our own workforce, so too are a lot of those private suppliers. So supermarkets, pharmacies, online distributors are also out making additional orders. So whilst there will be some shortage in supply over the next week to 2 weeks, we're expecting that from a fortnight onwards there will be additional supplies starting to come into the market. The New South Wales Government will continue to buy into that market, but so too will be many of the private operators accessing rapid antigen tests, so they should become more available. My strong message is please follow the guidelines on how to use a rapid antigen test to make sure you're using it properly and you're using it at an appropriate time. We also know that there's significant strain on our food, manufacturing and distribution networks, and the same way we've reacted in past waves, we're also making an adjustment, exempting asymptomatic people from their close contacts, whether they're a household contact or a close contact, from isolating, which will mean that if you're involved in agriculture, food manufacturing or food distribution and you're asymptomatic, you will be able to go to work and not undertake the isolation period. That public health order has been signed today. It is implemented immediately, and that's about shoring up our food distribution, food manufacturing supply chains to make sure that all of those things that we see in our supermarkets and across the general economy can continue to function. We've always said that we will pivot and will adapt to the conditions that are before us, and that's exactly what we're doing today. We've invested strongly over the last 2 years. We have an exceptional health workforce that is doing an utterly amazing job at this particular point in time, and we will get through this. The next 4 weeks is the most challenging for all of those strains that we have in our system and our health system and in the economy, but we're well placed to respond to that, and New South Wales will recover strong. The fundamentals of our economy are still as strong as what they were when we first went into this outbreak. They will be there when this wave crashes. We want to keep as many people employed as possible. That is what's going to lead to a strong recovery. We've done it before and we will do it again. Well, this is a challenge that we're going to have to meet. We know that as more people test positive to the virus, they will have to isolate. We're not making that change. We've heard consistently from members of our New South Wales health team, Nee said it here again today, that overwhelmingly the majority of people who test positive to Omicron will be able to manage their health at home. You won't require to be presented to hospital. This variant of the virus can be managed at home. Increase your drinking of water and your hydration. Use paracetamol to manage pain. These are the types of things that are happening right around the world. For those people who are not testing positive, if you're asymptomatic, then we want to be able to make sure that you can go to work in those most important critical areas of our economy. We are not putting any single person who's testing positive to COVID out in the workforce. If you've tested positive, you're at home in isolation. If you're asymptomatic, you're not a positive test, we want you working in our most critical areas.
Premier, in terms of managing home,
Yeah.
are there resources there to support that? Is that what you're advocating?
Yeah.
The big majority of people do it.
Absolutely, and it's a key focus that's often not seen, and that is the work that New South Wales Health does, and I might ask Dr McAnulty to make some further comments in terms of really focusing on care in the home for those people who need it. As Dr Nguyen has said, we are still seeing many people right across the state, when they receive a positive test, contacting 000 or alternatively coming to hospital when they are asymptomatic or don't have significant health conditions. Now, I know this is a transition and as we've moved through this phase, but we have invested record amounts in our health system over many, many years now, including at the outset of the pandemic, $4 billion to ensure that as we move through this phase, and that's not just in the bricks and mortar, in the staffing, that's also ensuring that we can provide that focus from health into care in the home. And as Susan Pearce, the Deputy Secretary of New South Wales Health, just raised the other day, that has been a substantial area of focus for the New South Wales Government and for her health teams.
A couple of points on managing complaints. Firstly, there are complaints about long waits on the COVID-19 phone line. That's obviously a resource issue to tend to.
Yeah.
Secondly,
Compromised.
immunocompromised who are at home.
Yeah.
Are you guaranteeing that they'll get connection with New South Wales Health? Clearly, they're the most vulnerable.
Yes. So obviously through previously and still currently through PCR testing, that connection for people with underlying health conditions is connected through to New South Wales Health. Now, in addition to that, as we move through to a rapid antigen test, the reason that we haven't immediately rolled out that Service New South Wales app is that we've had both Service New South Wales and Health working together to ensure that anyone with underlying conditions or serious health concerns are connected to New South Wales Health. But in addition to that, we would also say if there are greater concerns that people may have, if they do test for positive for COVID, to contact their GP. There's always a balance, a proportionate approach you've got to take, as the Minister has said, as we move through this next phase of the pandemic. We made similar changes, you might recall, when we were in lockdown, where through our essential workers, we made some changes there. But New South Wales Health balances the risks in relation to this change. We believe the change that we're making today is incredibly proportionate. It's obviously only in circumstances where you are deemed to be a close contact, that you are asymptomatic, and where a negative rapid antigen test occurs. So what is very important as we move through, as we know, the next 3 to 4 weeks are going to be incredibly challenging. But we've overcome substantial challenges during the Delta outbreak and the Alpha outbreak in the past, and we've pushed through. The only way out is through, and that's exactly what the people of New South Wales are going to do. And this change today, I think, will ensure we secure those important and crucial distribution networks. We work very closely with the sector. They've worked incredibly closely with New South Wales Health, and I believe the change today is proportionate to the circumstances that we find ourselves in. Angura. Yeah. We will work through that. We will work through that when we make some further announcements this week as we finalise that app. The position that the government is taking is that the registration of a positive rapid antigen test will be mandatory. And that's important, particularly for people who have underlying health conditions, but at the same time so we continue to collect the data. And our point would be, many people have made enormous efforts, shown great patience lining up in PCR queues. By shifting to this path as we move through this next phase of the pandemic, we believe that's appropriate, certainly the approach they've taken in Victoria, but we'll have more to say about that later in the week because the advice that I've received from both New South Wales Health and Service New South Wales is by the mid-week that will be available. The other point I'll just make, I think I made it earlier, was just in relation to that requirement would not be needed in circumstances where someone has a positive rapid antigen test but has also received a positive PCR test. Because and then Chris.
You say that you like the children to go back to school
Yes.
on day one. Is there a plan if schools can't reopen safely? What if parents aren't comfortable sending their children back to school? Is there an option to have remote learning for them? Are there plans for booster shots for Year 12 students that currently?
So we have worked over the last week comprehensively with New South Wales Health and the Department of Education on our back-to-school plan. We will provide an environment. It is not negotiable that kids go back on day one, term one, in a safe environment for both teachers, parents and students. That's what we're completely focused on. Now, there'll be different aspects of that, and those will obviously be considered by a National Cabinet. Now, it might be the case, and I've obviously seen the comments that the Queensland Premier has made, that there may be differences, but if we can agree to national principles, I'd certainly support that. I think that's the way to go. And one thing that I've certainly noticed over the last 2 years during the pandemic has been the information sharing that's occurred between states has been incredibly helpful. I know there might be the occasional sledging from time to time, but in the main, there's been constructive discussions. I certainly found that as Treasurer with the other Treasurers in terms of sharing information about how we can move through the pandemic. So when it comes to our education plans, we'll be releasing them obviously over the course of next week. We want to provide that certainty to parents and to teachers that we can open safely, and I believe that we will.
So, sorry, if you can't though, will there be opportunities for remote learning for parents that don't want to spend?
I understand, and as a parent, I know parents are kind of in two categories. There are parents who just want to send their kids back to school, regardless, and there are parents who are more concerned and anxious. We will work through that. So I don't want to pre-commit to those issues yet. We will release our plans holistically, and I believe that will give comfort to parents and to teachers that children will be safe during this period of time as we move through. And obviously the requirements that we put in will alter as we move through the next phase of the pandemic.
What about schools, Chairman? It's likely that this will be the case because I simply won't have enough teachers to actually have the school operating, and that is surely now likely. Is there a threshold?
Well, I don't want to give ongoing commentary in relation to what our plans are. We will release our plans in due course. Clearly, staffing is a core issue that we are focused on as we open up our schools. There is no doubt. There will certainly be bumps along the way as we open up schools. It's not going to be perfect. Our number one priority is to keep kids and parents safe. That's exactly what we will do. And I think when we release the plans, you'll see that all of those issues have been looked at, focused on. But I will say there will be challenges. There will be hurdles that come forward for us as we open up schools, but the alternative is to keep schools closed, and we will not do that. Last year, when we brought kids back to school, there were times we had to actually close schools. But in the main, the vast and overwhelming majority of schools stayed open, and that's incredibly positive. That doesn't mean that there's not going to be inconveniences as we move through. But I believe the plans that we have in place will ensure that we can open up schools day one, term one. Yeah. Yeah. Well, we see our role from a state level is ensuring that we use our rapid antigen tests in a way that supports our workers and continues to have society function alongside the virus. The alternative is to go into lockdown. That is the easy road, the hard road and the right road, as we've always focused on here during this period of time, is by rolling out a strong vaccination campaign, by rolling out a strong booster campaign. The efforts, personal responsibility, the efforts that our people have made to get vaccinated, to get boosted, has ensured that we can open up. This is what living alongside the virus means. It is not easy, but it is the right thing to do. And the issues in New South Wales are not unique to around the country. They're not unique to around the world. There are pressures on health systems. There are pressures on schools, and you would have seen many schools, particularly in Europe, who are opening up now, facing those same challenges. We can learn from that. In fact, that's all part of the thinking that we've put into place as we move through this next phase. Now, when it comes to the rapid antigen tests, it is important that we provide for an environment from a state government level that state services continue to run well. And our clear focus as a state, particularly for vulnerable people across our state, have the support and access to those tests. And that's why, as the Minister has said, areas such as remote Aboriginal communities, social housing, aged care, whilst that's in the domain of the federal government, we want to provide further assistance and support disability care. We will do everything we can, and that's why we've made this additional procurement of 50 million tests, because we want to make sure they're available to help people as we move through this next phase. Yes. Absolutely key focus, because what we see, particularly as we move through, and with school For many schools going back right at the end of this month, where we sit currently with the pandemic, that schools will be a #1 priority and rapid antigen tests will play a key role in the reopening of schools across our state.
Can we expect there to be a delay with the by-elections as well, given cases?
Well, that's not a matter for me, that's a matter for the Speaker.
Kerry, is it possible, and you've moved to help on the supply chain, obviously, but is it possible simply to just make that across the board in terms of the asymptomatic?
Well, yeah.
Have you looked at moving to that next, perhaps?
We are monitoring and working on this pandemic every single day. We make changes where we believe they are needed. Now, and Minister Ayres might make some further comments here in relation to those workers that we have put through this process today. That is still less than the essential workers we had during the Delta outbreak. But to your question, Chris, if we need to make further changes, we will as we go through. We are constantly assessing the evolving situation that's in front of us, and where changes can be made, we will.
Industries across the board
Are all facing challenges. Everyone, absolutely. This is a challenge right across the board. We've got to. We are looking at the information in front of us every single day. Where we can make changes, we will. New South Wales Health works with all the industries right across the board. Just like, as I said, during the work that we put together during that lockdown last time, we wanted to ensure, and we have to ensure, that distribution networks are secure. And we've seen globally, this is a substantial challenge. Now, I believe the change we make today, with the support of New South Wales Health, get that balance right. Now, as we continue to move through, we might have to make further changes, as we've been doing on a regular basis. But it's getting the facts in front of us, evidence-based, making changes. But in a lot of those industries, ultimately, the best thing we can do is remain open. We need society to be open. It's a key focus. We want society to remain open. We want people to remain in jobs. We want to look after the health care of people and keep them safe right across our state. That's the new balance. We're in a situation now that is very different to 2020 and 2021. We have a highly vaccinated population. We have a highly transmissible variant, but that is much less severe. And as a result, the changes and the policy decisions of the government meet the circumstances and the need of the times. But as there's no doubt, not just during the next few weeks, we will adopt our policy settings accordingly as issues like that continue to arise. But even post that, Chris, what we've learnt from COVID is you don't know what curveballs are going to come your way. You constantly look at the situation, our thinking evolves, and changes are made off the back of it. Yeah. Yes, I might get Dr. McAnulty to provide comment in relation to those deaths that may be occurring in homes. But what I can say, back to the earlier question, was there is a lot of work. We lead the country when it comes to care in the home, and you can't just turn that on. That's something that New South Wales Health has focused on for a substantial period of time. But I want to reiterate the message that if you're asymptomatic or you do not have a matter of emergency, please don't call 000. We are still seeing, and this is naturally in the ordinary course, a very busy time for our health system, but we still have people calling 000 for matters that are not emergencies, and that's putting further strain on the system. Oh, sorry, yeah. So Multicultural New South Wales is working very closely on that, and in relation to the rapid antigen tests, as the Minister has said, particularly with instructions and the like, that information will be going out to ensure that, particularly for our ethnic communities, that information is provided clearly. And Multicultural New South Wales and all of those groups, not just now, over the last 2 years, have worked incredibly closely with the New South Wales government. They've supported the government, they've supported their communities, whether that's been through, during those lockdown periods, providing the information, the booster shot campaign, the vaccination campaign. That could not have been done without the support of our leaders in our multicultural communities. We'll continue to work with them, and particularly in respect of the information for rapid antigen tests, because that's key, that they're done safely and appropriately, that information will be provided. But Malcolm, did you want to say some comments in relation to care in the home?
Thanks, Premier. In relation to deaths, yes, over the course of the pandemic, we've seen a relatively small number of people who've sadly died at home. And so, as part of the messaging around that is, if people are in an emergency, if their health is rapidly deteriorating, make sure you seek out assistance from either our helpline or your GP, or if it's a true emergency, call 000. That's what they're for, but we need to preserve 000 for those people who need it most. But it's important that also people, if they do have the symptoms, get tested. So by being tested, we can understand whether or not you have COVID and then plug you into the systems when you register. Sorry, I don't have that information in front of me. River. I don't know. It's not my area that looks at those applications.
No, I'll answer that.
Sorry.
Yeah. Novak Djokovic didn't make an application to come to New South Wales to participate in the ATP Cup. It was a decision that he made not to play, and so we never assessed his vaccination status. We never sought an exemption for him. He bypassed the ATP Cup and made a decision just to go to play at the Australian Open, and undertook his engagement through Tennis Australia, to the best of my knowledge.
We know with every other disease where there's a vaccine preventable component that many people will come forward quickly, and we'll see high rates up to about 95%. And we've seen a much quicker uptake, of course, with COVID, and thank you to the community for coming forward so quickly. But there are, a few percent at the end who, for a number of reasons, including convenience or just they don't want to get vaccinated. So the whole program has been to try and make it as convenient as people to get vaccine, and you can get vaccinated through a range of places quickly in New South Wales. So I guess we just need to keep working with those communities and making sure that people hear the message loud and clear. The vaccine is really important to protect not only yourself, but your loved ones. And that's why it's so important that we get those boosters, that if you haven't had your second dose, yet go ahead and book it. If you haven't had your first dose, please reconsider and make sure you get it. But also book in with your children, which begins tomorrow for the 5 to 11s.
Is there any particular hesitancy, or are they not aware that things will get as severely sick so they don't need the vaccine?
No, it's a very good question, and it's probably a combination of things. And I think because children often rely on their parents to make these decisions, to make these bookings, we really just urge parents just double check that you haven't forgotten to get those important shots for your children. Look, I'm sorry, I don't have that detail. I have their ages, if you'd like.
We'll get it.
We'll get it, yeah.
Yeah. So we have, with the support of New South Wales Health and the public health team, looked very carefully at the Newcastle group, and also anecdotally from our clinicians. They're seeing not all patients are typed, whether they're Delta or Omicron. However, there appears to be quite a different pattern where the Delta, which a significant proportion of patients in the ICU still are of the Delta strain, they tend to get the severe pneumonia and long intensive care stays, where those with Omicron irrespective of needing to be in hospital, their hospital stays are much shorter. And what we're seeing is they're not needing to go on the ventilators. So I don't have the exact breakdown, but that is the impression that we're getting. And you'll see with the ICU numbers that are being reported each day that although the numbers in ICU might be increasing, the number ventilated aren't rising as high. So we think that's a reflection of Omicron.
Segregation of infected and non-infected patients in hospital is one that was mentioned. What's going on?
Yeah, look, I think that what we've seen through our very careful sort of planning, and we have clinical groups to talk through and weigh up the risks and benefits and respond to what's emerging. And a decision, I guess the discussion, and I'm aware of the sort of paper reports about it, is that the reality is we're increasingly finding a proportion of patients who come in for other reasons. So they might come in because of emergency surgery, they might come in because of a heart attack, and they might come in that's unrelated. And Omicron happened to be found coincidentally, and they're asymptomatic from that. And what we know as doctors and nurses looking after these patients is that they're best cared for in the area that has that skill. So nurses who are used to looking after surgical patients, that's where they should be. And I think what we've been very successful at over the last 2 years is the overwhelming, I guess, education program around personal protective equipment. So I think the community should be assured that all our staff, irrespective of whether they're in a COVID-specific ward or elsewhere, prioritise both the safety and health of the staff as well as of our patients.
Thanks, everyone.